Understanding muscle contraction.
Muscle contraction is the process that allows your body to move. This movement relies on microscopic structures inside muscle fibers. At the heart of this process is the sliding filament theory, which explains how muscles create force and shorten. Let's break down how this remarkable mechanism works to produce every flex, step, and lift.
The building blocks, muscle fibers and myofibrils.
Muscles are made of long cells called muscle fibers. Inside each fiber are bundles called myofibrils, which contain repeating units named sarcomeres. Sarcomeres are the functional units of contraction, made up of two key protein filaments, actin, thin, and myosin, thick. These filaments are essential for the sliding mechanism.
Actin and myosin, the filaments that slide.
Within each sarcomere, myosin filaments have tiny projections known as heads, positioned alongside actin filaments. The sliding filament theory gets its name from what happens during contraction. The myosin heads grab onto actin and pull them inward. This causes the actin and myosin filaments to slide past each other, which shortens the sarcomere and results in muscle contraction.
The role of calcium and ATP.
Calcium ions and ATP, adenosine triphosphate, are vital for muscle contraction. When a muscle is signaled to contract, calcium floods the sarcomere, allowing myosin to bind to actin. ATP provides the energy for myosin heads to pull, release, and reset onto actin repeatedly, driving the sliding process. Without calcium and ATP, contraction cannot happen.
The big picture, creating movement.
As millions of sarcomeres in muscle fibers contract and relax, they collectively shorten the muscle, producing force and movement. This process, explained by the sliding filament theory, powers everything from blinking to running. Understanding this mechanism reveals just how coordinated and remarkable your muscles truly are.